Hi guys, this is Chrissy or Christina, as you've seen my name. My capstone project for the last couple of months was ultrasound-guided peripheral IV starts. I have worked at the hospital I am at right now for almost 7 years now, and what I've realized working at that facility is since we are a smaller rural critical access hospital, we just don't have a lot of resources that bigger facilities do. And so one of the things that kind of stood out to me was we were using CRNAs in our facility at all different times for ultrasound guided IV starts. None of the nursing staff except one ER nurse knew how to do it. And when I started in ER about 3 to 4 years ago, I was trained on the skill. And then when I started this master's program, I actually realized this would be completely awesome to train more nursing staff members on this skill to prevent having to call the CRNA. Okay. So the first thing that we did was identify the problem. So patients were presenting to our hospital, Abraham Lincoln Memorial Hospital, or ALMH, as a difficult IV stick, needing ultrasound guided technology to obtain vascular access. And so the protocol that we had at ALMH was for the staff RN taking care of the patient to call the house supervisor that was supervising the entire facility. The house supervisor would then call or page a CRNA that may be working in-house, or if it was at 2 a.m., that's a call at home, okay, to come in to start an IV, which is crazy. And so the CRNA actually had up to an hour to respond to this call. What we were seeing with patient care at that point was a delay in medical treatment and diagnosis because, we couldn't get lab work potentially, or just, you can't start medication, antibiotics and stuff if you don't have IV access. It was an increased wait time, length of stay for the patient themselves, increased cost because the CRNA would bill the patient for their services. So they would get a separate bill from the CRNA, and when we trained nursing staff on that, that took away that bill. And it overall decreased patient satisfaction. So overall was just not the greatest process that we could have had. When talking about difficult IV sticks in ER, we see all walks of life. And so patients presenting with these issues, such as obesity, we just kind of say they might have extra fluffy arms that make it a little bit more difficult for an IV stick. Diabetics, your vasculature just decreases over time with that. Drug abuse or addiction, if someone has been using heroin for, the last year or so, they have a lot of scar tissue buildup in areas that we would start an IV in. A mastectomy on the right or left side. Obviously, if you had a right mastectomy, you cannot use the right limb for IV sticks or blood pressure. So that kind of takes one arm out of the view there. And then if you are working only on the opposite arm, well, maybe that arm's been stuck multiple times, making it more difficult. Same concept goes for, your dialysis patient that has the fistula in the arm. Any type of contractures, so quadriplegics or anything like that with maybe Parkinson's, they're contracted up. COPD, cancers, the pediatric population just sometimes are harder sticks in general. Various varying ethnicities, multiple injuries or trauma depending on what's going on with the patient, and then peripheral venous disease. So all of those kind of posed a little bit of a challenge for nursing staff. Why we wanted to start the ultrasound IV class would be to decrease the number of attempts for peripheral IV starts. We don't want the patient stuck 10 times, before we get access on them. Per protocol, we have the bedside nurse do 1 to 2 sticks themselves, and if they're unsuccessful, then we need to be calling either an ER nurse, or now we would actually call the nursing staff that is trained on the skill. It's a decrease the amount of calls into the CRNA staff. So they were actually very, very, very excited about this project because it was, taking time away from them. I can't imagine getting called at 2 a.m., in the middle of sleep to go just start an IV, in the ER. So it's kind of crazy to think about it. Like I said before, decreased costs for the patient, decreased wait times, and overall just an increase in patient satisfaction was what our main driving force for this class was. So my capstone proposal was to create and implement an ultrasound-guided IV start class at ALMH to train nursing staff members on this skill. I worked together with the nursing managers from the departments at ALMH, and I wanted them to choose staff members that were engaged, involved, that they felt would really succeed in this skill, both from day and night shift. And the importance of that is just to create more of an option to have people trained in that skill. So not everyone on day shifts trained, and then you don't have anyone on nights, and now you're calling a CRNA on nights or vice versa. So we wanted people trained from both day and night shift. It was to implement a 4-hour class. So for the first hour of the class, we taught over, and when I speak of we, I held the class. I taught the main class itself, but I also had Tim, another ER nurse, who actually trained me on this skill. And then I had Jean, a CRNA that has been a CRNA for almost 30 years, doing the class with me just for extra support with the hands-on training. So when I say we, I'm referring to the group of us, but I was kind of the head starter on this. So for the first half of the class, we taught vascular anatomy. So they need to know where they're sticking, what veins, arteries are present, okay, what they're looking for, what they're looking at, how to use the ultrasound machine, the supplies needed, steps to the catheter insertion, how to properly document it, especially if you're going to different floors, proper cleaning of the machine, cleaning up after in the patient room, and then potential complications that could occur. And, you know, a potential complication would be like, what if I stuck an artery? Okay, the student needed to know if that happened, what do I do when that happened? Okay, because complications do occur. It's nature. So the second half of the class was just strictly hands-on training. So we brought in the CRNA ultrasound machine that they use, and we had the one from our emergency department. So we had 2 ultrasound machines in there. We had 6 students total. I had a bed, a stretcher from ER, and a bedside table. So you were actually able to simulate what it would be like to be at the bedside to do an ultrasound-guided IV start. We were able to borrow gel simulation pads from Memorial Medical Center, the larger facility that we're affiliated with, the teaching hospital, and those actually had 4 vessels in them. So you could visualize, you could put the probe on the simulation pad, visualize 4 vessels or veins in there, and you could actually cannulate the vessel using the ultrasound technology, and it had fake blood in it. So they were able to see the blood flow coming back into the catheter, knowing, you know, just it really, really simulated the experience and really gave them some good hands-on training. And the students, that was probably their most favorite part, was usually using the gel simulation pads. And we actually, after we implemented the class, were able to be approved to purchase some for our facility. So now these students and hopefully further students in the future can practice with them too. After the class was implemented at ALMH, we wanted to send them to Memorial Medical Center, the bigger facility, with the PIC team. Those are a group of nurses that literally their job day in and day out is to start IVs via ultrasound if they have a hard stick anywhere in that hospital, and they insert PIC lines. So they're very well versed in that technology, those skills. They're so experienced in what they do. And I thought it would really benefit those students that we had in the class to go shadow them and work at the bedside with them and use their machines and just get different points of views and perspectives, kind of open their mind on stuff, gain knowledge, experience. So we sent every single student one at a time. They were one-on-one with a PIC team member working at the bedside. And then after they did the training at Memorial, they came back to ALMH and finished up their witnessed ultrasound-guided IV sticks with either like me, Tim, or a CRNA witnessing those sticks to check them off and deem them being competent. Okay, so then after the students were deemed competent, we now had 6 nursing staff members trained on the ultrasound guided technology. So then how supervisor could then make a call to them versus making the call to the CRNA. So then that led me into the projected capstone outcomes, which you see on this slide. So my first one was that ALMH will have 6 RN staff members, both from day and night shift, competent on ultrasound guided technology by the end of September. And that was awesome. We have everyone trained, competent. They have been working at the bedside with patients for over 2 weeks now. My next outcome was ALMH will see a 50% decrease in the number of calls made to a CRNA for IV starts within the first 2 months. This has actually had a 100% decrease so far, because over the last 2 weeks we have made 3 calls for ultrasound guided IV starts, and all 3 of those calls were made to one of the students and not a CRNA, which is very exciting. And then my third project outcome was ALMH patients needing an ultrasound guided IV will have a 20-minute decrease in the length of stay from previously obtained length of reports. So basically that one, we were looking at length of stay reports from when we had to call that CRNA and how long did that patient wait prior to the CRNA showing up, getting all the supplies ready, and finally being able to start that IV on them. We have seen more than a 20-minute decrease in the stay, because instead of having that 1 hour time to respond to that call or that page, we are now calling someone that's already in-house trained, and they're able to have someone cover their patients during that time, and they respond directly to that call. So it's very exciting to see all the results coming through with the outcomes. The learning style that I chose for my capstone project was the adult learning theory. And this really just went into because, you are working with nurses that are trained professionals and they're adult learners. And I have the listed benefits there of the adult learning theory, increased retention, understanding of information, a greater sense of accomplishment. And I feel that stood true with the adult learners. And then the next slide coming in here talked about simulation with adult learners. I don't think the class itself would have been so successful without the use of the simulation with the ultrasound machine, the hands-on training with those gel pads. And it's just really proved true with simulation and how effective it can be. And they were able to, just like that's listed on there, the learner's self-confidence and satisfaction. They felt more confident after that hands-on training skill session to go to Memorial to work with the PIC team and already have that knowledge, prior to going there. And it gave them confidence for it, which was awesome. This was an example of simulation. So here, and I'll be using my mouse here. On the left, this is one of the nurses I work with. He was actually simulating what it would show to do the C technique with his pinky and holding up the probe. So that was kind of an example of simulation. And then we actually showed, when I was in the first half of the class, was an example here of what an artery versus a vein would look like. And I just thought this would be cool for you guys to kind of see this as well. So when you're looking at an ultrasound machine and you're differentiating between an artery and a vein and wanting to cannulate a vein, obviously, and not an artery, this would be an example of where an artery would be pulsating against the pressure. And I actually have one of my other nurses, he talks in this video a little bit, but you can see the pulsation of the artery itself there. So I'm going to pause that and then I'll go over here. And then this is when you put pressure on a vein and see how it would completely collapse. And so the students were really able to visualize this through visual aid in the video and then use that skill, in the hands-on portion to really use that on the probe and differentiate between an artery and a vein. So that was one of the examples that we did. I just thought it was really cool to be able to see that. So I wanted to share that with you guys. Okay. And then the resources that I used for this project, the director of nursing and nurse educator at our facility, completely amazing with everything that they helped out with. They were more than willing to support me in this project, along with the nurse researcher from Memorial, just helping kind of collaborate those people that I needed from Memorial, especially like on the PIC team manager, which I have listed down a little bit down there too, and the nursing department managers from ALMH. as well, picking out the staff members that they thought would really succeed in this skill. And they were spot on because the students that we had in the class really loved it and are succeeding at that skill. The CRNA